Hello, I'm Lisa Brown. I'm Quincy Brown's wife and the other side of the AML journey. On the first video, my husband shared the week leading up to his diagnosis as far as his symptoms go and how we found out. This is my side. So approximately a week or so before his diagnosis, we had just come back from a funeral. My sister had passed away after a lifelong battle of chronic illness, which included cancer, which ultimately took her life. We were driving back after her funeral. My family lives 10 hours away, and we tried to make it as normal as possible for our kiddos, so we made all the regular stops. We stopped at Buc-ee's, and I remember telling my husband and my daughters, make sure that you wash your hands. We don't want to get sick. It was October, so it was around the time the illness was going to get started. So we made it back, and of course, both my daughters and my husband got sick. And I said, I told you so. You should have washed your hands. So I just figured they picked up a bug. Ultimately, like 2 or 3 days in, my daughters got better, but my husband was still having headaches and congestion. And so we kind of chalked it up to it's taking him a little bit longer to get better from that illness, from whatever he caught. But then it turned into migraine headaches. And so we both kind of chalked it up to the seasons changing, and migraines happen more during season changes when temperature changes. And so we said, okay, it's a migraine. About 2 or 3 days in, he still had the migraine. He had taken his migraine medicine and it wasn't going away. And so I suggested to him to go to urgent care to get a migraine cocktail, which he did. And it made him feel better for all of 2 or 3 hours, and then the headache was back, which was obviously really annoying because at that point in time he had already had a migraine for like 4 days. And so Monday rolls around, we call the primary care doctor and we say, hey, we need an appointment. My husband called to make an appointment, and they tried to tell us that we couldn't get in until Friday, but I said, no, we can't wait till then. My husband's already been in pain for 4 days and nothing's helping. He needs to be seen sooner. And so they got him in the next day. So the next day, Tuesday, he gets in and they do blood work, and they gave him an injection to make the headache go away. And it did. Again, it worked for a couple of hours. He came home and it came back. I called the doctor that afternoon and I said, hey, if his headache comes back and it didn't work, then what do I do? And they're like, okay, we'll go to urgent care again if it's after hours. So that's what we did. That afternoon, we went back to urgent care. But by that time, some of his blood work results were coming back. So the urgent care place that we went to also was the same. So we go through Texas Health. So the primary care doctor and the urgent care place that we went to the second time were both in the same network, and so they could see each other's results. So the urgent care doctor at urgent care looked at some of his results, and he made a comment saying that his blood work looked like somebody who was going through chemo. And knowing what I knew about my sister's journey, I knew that that wasn't good. My husband has never been through chemo, and I can't imagine any illness that would be causing such drastic numbers. So it was concerning. And I was very hesitant to bring him back home. I said, if he looks this bad and if he's doing this bad, then we need to take him to the hospital. The doctor said, well, just make sure that you follow up at the urgent care, said to follow up with the primary care doctor, that, they'll probably give us referrals to other doctors. And we're like, okay, well, reluctantly we went home, and they did give him another cocktail there to treat a migraine. But as we know, it wasn't a migraine, so it only lasted for a little while. Something else that they gave him while he was there was oxygen, which made him feel better immediately. But after learning a lot more about what AML does to the blood, it made sense that oxygen was helping him because his red blood cells were so low that he was oxygen deprived. And so that made him feel better, and we came home, and then it didn't get better. That was Tuesday night. The primary care doctor had made appointments with a hematologist and made a follow-up appointment with him to run more tests. But Wednesday came along and he got weaker. It was getting harder and harder for him to do the morning routine that he usually does. He gets my kids snacks ready. He gets my lunch ready. He gets the kids' lunch ready. He makes breakfast for us. He is a stay-at-home dad now that he's retired after 22 years of serving. He prides himself in being the stay-at-home dad because he loves it. And so he couldn't do that. It was taking a lot of breaks. He had to sit down, he had to take breaks. Then the rest of the day while we were gone for school and work, he would spend it resting. And I remember there was a point in time at night we were discussing about how he was feeling, and I said, is it possible that you're really affected by the loss of my sister so much, because they were close, that sadness is causing some, physiological issues. And we discussed that maybe that could be it. So we didn't know what was going on. So it was like, okay, well, then Thursday came along, and again, same thing. Struggled in the morning, really weak all day. Like I remember looking at, we have a Ring camera, and he never left the house. And then I would check on him, and he would always be like laying down, resting. And I said, okay, that's fine. Do your head still hurt? My head still hurts. I don't have any energy. I get winded easy. I'm like, okay, well, you just keep resting. When we would come home at the end of the day, I would keep the girls not away from him per se. I would just say, just be precautious, because I didn't want the girls to like get him further sick. And because he had a migraine, you don't want to hear loud sounds, so that I kept the kids quiet. I kept them away. I took care of all the afternoon stuff, which I was happy to, because I also suffer from migraines. So I know what it's like to go through that situation or to go through those symptoms. So anyway, that was Thursday. And then Friday morning, he got up and he tried to do the morning routine again. But this time, he really got lightheaded, and he sat down and he mentioned it to me, and he said, I'm really feeling tired. I had to sit down and take a break for, like 5-10 minutes before I could continue to do what I was doing. So he told me that. And in this week, I had been kind of helping him in the morning because, he was struggling. So when he told me that, I went back to getting ready, and as I was walking out to go help him, he was rushing into the bed, and he collapsed on top of the bed, barely made it onto the bed. And what I noticed the first thing that I noticed was that the bottom of his feet were like white, like sheet white. There was no blood in his feet. And I touched them, they were cold, and I'm like, okay, well, he fainted, so all of the blood is going to his organs. But then it also made me feel like he doesn't have enough blood in his body to circulate to his limbs. And so I went and I looked at his face, and he was disoriented. He was mumbling, saying that he was really tired. And then as he was talking, I noticed that his lips were very pale. His face was gray. And so I looked, I pulled his lip back, and it was white, just as white as his feet. And I said, this is it. Like, there's no more waiting for appointments. That's it. I'm taking you to the hospital. So dropped off my elementary school kiddo and arranged for my other kiddo to get dropped off to school as well. And came back, and I put him in a computer chair, and I rolled him to the door, and I put him in the car. And this whole time I'm like, he's gonna pass out on me again. And he, like, the few steps that it took for him to get to the door to the car, it's like he collapsed into the car, and I had to help him in. So we made it to the hospital. I gave them all of their symptoms, and they checked his vitals, and I told him, he had fainted on me. And at that point, the emergency room doctor had started looking over his blood work, because again, it was another Texas Health hospital, like an actual hospital, not urgent care anymore. And she looked at him, and they immediately admitted him because his blood work basically all of it had come back. So they admitted him, and the doctor was kind of trying to talk to us and saying that they were going to run more tests and they were going to keep him. And I tried to ask, like, what does she think? And she's like, well, you don't want to know what I think, but we're going to figure out what it is. She's like, we're just, basically gave me the understanding that it wasn't good. And so hoping for it not to be really bad. So anyway, they ran tests. And as they were running tests, I looked up what the tests meant. I was one of those, Googling people. Like as soon as that they would order a test and the test results would come back, I would look up what is this test for? What are they looking for? And I was rabbit holing into what are they looking for? What are they looking for? And ultimately, the process of elimination of all of the tests that they were running, it was either going to be a autoimmune disease or leukemia. And so, obviously, I'm praying that I don't know, that he picked up some kind of random virus that's causing this and he's going to be fine. But ultimately, when they ordered the bone marrow biopsy, I knew that that's the two things that they were going to try to rule out or trying to determine which one it was going to be. And so they told us preliminary results would come back within a week, and the final results of everything would be two or more weeks. And so we knew that we were in for the long haul. He was going to have to stay and he was going to have to be taken care of. Obviously, his blood work was so low and his hemoglobin was so low, they had to give him a blood transfusion. Again, with my sister's experiences with chronic illness and cancer and chemo, I was familiar that would be something that would happen when somebody has cancer. And so it was kind of like little hints of things that was going to happen that were kind of showing me that this is a road this is a journey we were beginning. But I wasn't sure. It wasn't definitive. Anyway, he got his blood transfusion and it was an experience. It was an emotional experience for both of us, for him to experience having to need that. He's the kind of guy that doesn't need help from anybody. And so for him to be in such a vulnerable place and for him to need so much help, as much of a brave face as he put on, I knew it wasn't something that he was taking lightly. And so he got the blood transfusion. When we went to the hospital, that was on Friday. Saturday, they were running tests. And then I had brought my girls up there to visit him on Saturday. When they told us that he was neutropenic, I didn't really understand what that meant until we went up there Saturday with the kids and they were giving us all of the precautions that we needed to take while we were there. And so I was like, oh, wow, he has very minimal white blood cells, which means he does not have an immune system. And so at that point, I said, we're going to enjoy our visit, but we're not going to come back. I'm not bringing the kids back on Sunday. So on Sunday, I made arrangements for my kiddos to stay with a neighbor, very close friends of ours. And I dropped them off, and bear with me if I get emotional. This is the third time I record, and the other ones where I was a blubbering mess. But I dropped off my girls, and as I was walking back from dropping off my girls, I got a phone call from my husband and saying that the doctor was there and needed to talk to us both. And I said, oh no, and my heart sunk, and I was like, hold on, I was just trying to get across the street to make it into the front door of my house, but then she started talking, and she told us that, all I heard was something about the preliminary results came back, something about blasts, and that my husband had leukemia. So I heard it, and there was silence. I got into my house and I collapsed onto the sofa. And I said, okay, I'm on my way. So I hung up the phone. And I said, I need to get myself together. Shake it off, not shake it off. It's get yourself together. And so I cried, I screamed, I prayed. And then I got myself together and I jumped in the car and I called one of my other neighbors, who's a close friend of mine, and she's a nurse. And I said, talk to me while I'm on my way there. Talk to me. What's going to happen now? She was amazing. She talked to me the entire way there. And it was just a lot of, tell me that we're going to be okay, that he's going to be okay. So I finally made it to the hospital, and I walked into the room and I saw him and I ran to him, and there was somebody there sitting with him, and I found out that's a chaplain. And I'm thinking to myself, God, if the chaplain is there, it must be really bad. And so we prayed, we talked, and then they told us that the next steps were going to be that he was going to be transferred to another hospital, which had an oncology unit. And he and I discussed, like, should we go to this hospital? Should we go to this hospital? Should we go to Houston, where, there's a lot of really big hospitals, really big name hospitals? And so we did talk to the hematologist that was at the hospital that diagnosed him. And she said that, the doctor that was here was very good, and that he follows all the same protocols as they do at those big name hospitals. And that we just to weigh the options, that it's up to us wherever we want to go. But after my husband and I discussed it, it was kind of, we boiled down to me being able to be with him in this process while also taking care of my kids. And so we decided to go to the hospital that was close by. So we ended up at Texas Health Presbyterian in Plano. And so then we went there. They told us, you're getting transferred today. And it was a Sunday. So I was thinking, again, it must be awful because we're getting transferred on a Sunday. Who gets transferred on a Sunday? Anyway, so we got there. We met the charge nurse. We met the oncologist and the oncologist nurse, which was very, very sweet. She was kind of like his right-hand man and kind of gave us the rundown of like what's to come, the treatment the induction treatment he was going to go through. But most importantly, she told us something that has stayed with us the entire time, which is your journey is your journey individually. Whatever you're going through this process is your process. Not every case is the same, so don't compare yourself to any other case. Whatever challenges you face is not challenges other people will face, and vice versa. And so we took that to heart. We were really absorbing everything they were telling us. And so after that, my Googling stopped because I thought to myself, those first few things that I found out were scary, were so scary and very, negative. And so when she said that, I took it to heart and I stopped. I didn't look for it anymore. I said, our journey is our journey. What will come, will come. So he and I agreed that that's what we were going to do. So that takes us all the way up to when he was admitted to the oncology unit. And they did explain to us that his induction was going to be at that hospital, and he was going to be staying at the hospital for that initial treatment. It was a big learning process. There was a lot of words that I needed to learn. There was a lot of jargon that I wasn't familiar with. And I'm the type of person that loves to know everything about everything because that kind of gives me a sense of control. And it helps me try to understand things. And I think it helps guide my prayers as well, so that I know how to really like hone in on what I'm praying for. So I did, look up what is induction, what is, what kind of medications is he getting? What are they for? Side effects, things like that, just to kind of be prepared of what was to come, like what he was going to be feeling, so that I understood, like, if he had a symptom, that it was because of medication. So I did do those things. My next video will be about the induction phase and our experience and complications that came up along the way while we were there, and my process of going back and forth and what I did, my schedule, my daily schedule, and how that affected my work. But yes, that'll come for the next video. What I did want to say, and I wanted to be very clear in the difference between the person experiencing, the patient, the person experiencing AML versus the caregiver. I think what comes to mind is when you're on a roller coaster, because this is such an emotional roller coaster. When you're on a roller coaster, the ups and downs and the scary moments when you're climbing And those scary moments when you're dipping both the patient and the caregiver experience the same ride. I imagine that the person experiencing it is in the front seat. They see everything. It's their experience, right? When you're in the front seat of a roller coaster, you don't see anybody else on the roller coaster. You just see what's in front of you, and you only see the scary that's in front of you. And as much as you love your caregivers, you don't see them when you're experiencing that. And I think as a caregiver, I had to learn to give grace when I understood that my husband felt like he was the one experiencing it and I wasn't. But when you're the caregiver, you're like in the second row, just as scary, and you see them in front of you, and you're with them, and you got their back, and you're there experiencing the same roller coaster. But you see them and they don't see you. So I want you to think about that when you're going through your troubles and when you're going through your roller coaster, through your journey, that as a caregiver, understand that they don't see anything but the roller coaster ride. And as a patient, I know that you can't look back to see your caregiver, but know that we are experiencing everything just like you. It's just as scary for us too. So give each other grace. Love each other. Enjoy every moment that you have. Stay positive, and don't compare your journey to anybody else's. That's it for me for this one. I will see you on the next video, and I hope this has been helpful. And I hope that when you leave this video that you can take a sigh of relief in knowing that you're not alone. All right. God bless y'all. I'll see you next time.